Can my slides is visible? Hello? Hello?
No, madam.
Answer. Now? Hello?
Yes, madam. Visible.
Yes. Yes, yes, as it's already mentioned, Ayurreshmi, as name only suggesting, it's like a ray of hope. I can think you in this point. Yes, learn, education, and encourage, yes, for propagation. And it is relation to the exam orientation. Frankly speaking, this is the time, hardly you have 1 month, short duration of it. Is not that I will teach you from the beginning how you need to be. Now I only give, like, here we need a smart work so that you can score better in your final exam, because it's just a exam point of it, how you can prepare well. In this regard, you already know like how your syllabus is distributed. Going with the topic, going with the Prasuti and Siroga perspective, where we have a paper 1 and paper 2, where in paper 1 we have a 100 marks theory paper, and paper 2 also 100 marks theory paper, and total making a 200 marks question paper, and 50% is eligibility for your clearance. And going with your practical examination in the other part, 100 marks you will be writing, and then 60 marks vivas will be there, and elective, I think you already appear for it, 10 marks from there, and your internal assessment will be scoring 30 marks. Okay, this in just how your marks distribution is done. And going further with, like, we have 11 topics in paper 1 and paper 2, where we have total another, like, making into 28 topics in total. Going further, like how the marks distribution is done as per your university question paper, paper 1 and paper 2. In paper 1, as you already know, like MCQs will be there, 20, 1 marks carries each, and total making a 20 marks. And then going further, like SLAQs, where you have 8 SLAQs will be asked, and that makes total 5 marks each and making a 40. That is 8 questions and 5 marks each, making a 40 score. And LAQ, like long answers questions, it carries a 10 marks of 4 questions and making 40 marks. So totally 20, 40, 40, and altogether making a 100 marks. Okay, this is how your question paper is planned. And I think you had already seen the blueprint of like how the distribution of your theory examination will be done. And prior to that, you should be well aware these all questions, whatever it is mentioned, like 20 questions, 8 of SLAQ, and then 4 of LAQ, all are mandatory. It's a mandatory and compulsory. You have to attempt all the questions, and then as such you don't have a negative marks. If you're marked wrong, you're losing a 1 mark. Yes. And another thing you need to be well aware, like maximum question from the multiple choice question will be drawn from must know topic. Probably you will be aware of your, because for us it's a newer third BMS is a newer CBDC batch, but still you're already experienced with your past two professional batch. MCQs are mainly the must know topic will be drawn from the syllabus. Those questions will be drawn from that. And desirable know, as such in MCQs it won't be included. And nice to know syllabus is also not included in your MCQ. Means MCQs is multiple choice question. 20 questions will be mostly, 99% of the cases, they will be only drawn from must know topic. And another thing, SAQ, you have to know, because these are all the smart work from where you have to read the things. And going with SAQs, here also like must know topic is the major thing, because here comes where your cognitive comprehensive topics most commonly. Usually it carries around 5 marks questions, SLAQs. So going with that, you have to know about the cognitive comprehensive questions are more towards it. And here also desire to know. And then nice to know topics won't be coming under SAQs. And then here what you need to say is whatever the question, for example, any question has been drawn from it, you have to understand the question. See, final year is all about your understanding and implementation. So how you understand and how you applicable in clinical practice, and then analyze it, and you have to write on that topic. It is not that directly the monotonous way you will be writing like theory. Once you receive the question, continuously writing about it. No, like how you split it, how you understand by giving its understanding, application, and interpretation, and then going with the gist of it, like discussion or conclusion way. You have to, in 5 marks question, you have to simplify in that way, but the conceptual should be there in this topic because it carries the 5 marks. And going with LAQ, it is also exclusively from the must to know topic, and there won't be desirable and nice to know questions. And it just you should know MCQs, SAQs, or from the LAQs, nice to know and desirable to know we won't be taken to consideration. Only the main topic is must know. You should be thorough from your syllabus point of it. And going with that, like it's already I mentioned, like it's all the cognitive abilities where we will be framing a long questions, long answer questions. There may be split, like 10 marks question. They may only split and give you like derive this and derive, like anatomy as such, and specifically they may ask you like in internal genital specific organ to explain the anatomical structure or supports of uterus or something like that. They may split the question and then make it that is long answer question can be structured questions, especially the what I want to say is 4 questions of LAQ where they can make you structured question and they can deliver it. Okay, this is in general how they will be drawn a question paper from your theory question paper perspective. And same way in the practical perspective, you already know, like I already said, 100 marks practical will be there on 65 hours and 10 from your electives and then 30 marks for your internal assessment. Going with a major practical exam where you have a case taking, 2 cases will be given, usually from 1 Prasuti and 1 Stri Yoga. It carries a 30 marks each. And then spotting and identification, there also we have a specification, 10 instruments. Okay, you have already enlisted with instruments in your syllabus. You have to know identification of it, uses of it, 1 or 2 at least from the obstetric and gynecological perspective. And then 2 drugs, maybe a fresh drug or a dry drug can be put it for a identification, like Ashoka, twig can be kept, or Kumari can be kept. Okay, that related formulations or the what exactly the guna karma, how exactly it is helping, especially in the female reproductive system. It's not that, you know, like Kumari is skin, it is good for skin and other thing, but specifically we are expecting is Yakrut Uttejaka and indirectly it is referring for Artavajanaka. Like that specific usage of the identification and the part used, especially in Prajanana Samsthana, we are expecting to write in the exam. And then 2 models of it, identification and writing on that model. And then 1 specimen identification and elaboration of, and preferably in the final year, we're expecting clinical perspective, maybe in the obstetric or gynecological perspective, you have to elaborate. And 1 more question is, this is for 30 marks. See, 2 questions for 30 marks and another 2 questions for like identification, spotting, 30 marks carries, total 60 marks from that. And the next is clinical skill-based questions. They frame a question, maybe they may give a clinical scenario, with maybe like Kaphaja in Sriroga perspective, or maybe a scenario of labor, whatever it may be. Then you have a subheadings like proper history taking, relevant to that is skill-based questions will be framed. That is from the clinical, like how you like relevant investigation for that case, how you will evaluate, or examination perspective, like key points they may put you, that is clinical skill-based question. And structured viva was where they have to go for, like we have a shloka recitation, 16 marks of viva, that is also splitted. Like you have to go with shloka recitation, conceptual understanding how it is there. It's already framed. Okay, we have to conduct because it's a structured one. You can't skip. We have to ask in this pattern only your viva so that 60 marks will be allotted. Okay, this is how the thing. And then record writing and other things you already finished. That carries 20 and 30 marks for your. This is in brief about how the theory and practical question paper will be framed. And going furthermore, like already I said, only the topics I had mentioned, few 3 to 4 questions I'll be topics I'll be covering, but generally how the questions will be coming, majorly I'll be talking about. When you go with the Sriroga and Prasuti perspective, especially on the Sriroga, like Prasuti, when I go with the first topics, like 1 to 11 topics are deputed for Sriroga. Sorry, Prasuti. In that first thing is Tri Vishishta and Sharira Vignana. And in this topic, it is mentioned that we have to take MCQs and then SAQs and LAQ mandatorily from Sri Vishesha Vignana because it's a must-know topic. There are even few topics are being given desirable, but here Sri Vishishta, physiology and anatomy is a base of any clinical understanding. What I want to say is almost all the 11 topics of Prasuti except Stanya Vignana because it's a part and parcel even to the Kaumara Bhritya, except in that, in all the above topics, like from the Sri Vishishta Sharira Vignana, Rutu Chakra, Garbha Vignan, Garbhini Vignana, Garbha Vyapat, Garbhini Vyapada, Prasava Vignan, Prasava Vyapat, Muda Garbha, Sutika Vignana. Among all these topics, all sort of MCQs, LAQs and SLAQs. All things will come. Only exception for Stanya Vignana. They can go with cognitive comprehensive like 5 marks question, but in from Stanya Vignana, they should not ask, as the blueprint says, they should not ask any question from 11 marks question. That means you got a clear point. From these 11, one topic is cleared for LAQ. Means in the top 10, they may ask you 4 questions of LAQ from any sort of question. That means anatomy and physiology. That is mandatory question. They may expect it for 10 marks question. So like female reproductive system, especially the internal genitalia, and then what do you call Shroni? Okay, that is also comes under Sri Vishishta Sharira Vignana. Because now I am commenting among these 10 topics, what are all the major LAQs we can expect? That is, one is like female reproductive system as a whole, like anatomical perspective. And then they may ask you like, they may split because structured question is also possible. They may even ask you to go towards like, they may split anatomy of fallopian tube or ovaries, or maybe accessory reproductive system like breast also they may ask you. And they may split like supports of uterus you should write. Like they can structure the question, but as a whole, anatomy of female reproductive system, like starting from the internal and the external genitalia and even accessory reproductive organ, that is a breast, they can make you a structured question split and they can ask you for LAQ. That is a mandatory must-know topic. So definitely they'll be asking from these top 10 topics. And then Rutu Chakra, when you think of that, it is the expected question for 5 marks also and the 10 marks also, like physiology of menstruation. Because in your syllabus only it's framed. Like I won't be repeatedly saying because everyone have your syllabus copy, but most expected question is like physiology of menstruation, and even they may go in the perspective of endocrinological aspects of Rutu Chakra or menstrual cycle. As a specific, they may ask you with respect to Rutu Chakra. And then Garbha Vignana, yes, once again embryology will come, the basics of Garbha formation and other thing. There also you may expect 5 marks question often. That is also suitable for LAQ, but maximum questions from the Garbha Vignana and other thing we can expect. Masanumasika Garbha Vriddhi. That is the only one they may ask you for majorly, especially at the UG level. They may go with LAQ. Otherwise, usually it may go with it. I'm not telling because all the top 10 topics in 11, all are must-know topics. You may expect for 11 marks also, or 10 marks also, or a 5 marks also. But what I insist is you prepare these all major content for 10 marks questions. So even they ask for 5 marks, you can condense it. If they ask you for 10 marks, you can elaborately explain. What I insist is as a gist, you can make. Say anatomy, you can make a gist. As such, there is no differentiation. And when you go with Rutu Chakra also, same thing, physiology of menstruation, you can prepare for 5 or 10 because those are the mandatory questions you will be expecting in these topics. And then even Ayurvedic like Rutu Chakra, when exactly Dhatu and Dosha, like relations of doshas, those all they may interpret and you can comment it in 5 marks question also. But majorly it will come for a 10 marks expected question. And then Garbha Vignana and Garbhini Vignana. Yes, here also I already said like Masanumasika Garbha Vriddhi is the major concern in embryology of and fetal development. That usually expected as 5 marks question. And here Garbha Karabhavas that may ask for a 5 marks question, and Garbhadana as such they may expect it for 10 marks questions. Okay, because everyone want to have a Shreyasi Prajan nowadays, like preconception care is evolving. Even you may get a question in relation to Garbha Vignana as in relation to preconception care and Garbhadana Samskara. You interpret. See, I already said LAQs is always like how you are going to applicability and how you will be interpreting. So all those things may expected in Garbha Vignana. And one more major thing for fetal development, Garbha Poshana Krama. That is usually go for 5 marks question at the level of UG. Okay. And then there is some other points also, like you have Garbhodaka and then Garbha Nabi Nadi and other thing. That is usually like like anomaly, like malformations. That is interference with fetal growth and development can become as 5 marks question, especially at the UG level, like placental abnormalities or umbilical cord abnormalities. Usually it is expected question for 5 marks. Clear? You're getting my point? Whether I'm audible? Yep. Yes, fine. And then going with fetal nourishment, yeah, same thing like fetal circulation. These are all mainly expected. These are the basics of Prasuti. So you will be expecting much more questions from, because these are all the general thing. What I insist is Stri Vishishta, Rutu Chakra and Garbha Vignana. You prepare a 10 marks notes and keep aside. So that they ask for 5 marks or a 10 marks, it's easy for you to present it. And then Masanumasya Garbhavriddhi, you already read in a first year, but try to implement with embryological growth and development with a modern perspective, some more better way. Okay, how the genesis of the Mullerian death and how the ambiguity of sex, such preferable, because final year, na, bit polishing way you have to write it with a UG level. PG, I would have specified like what and all the things you have to write, but UG level, at least you'll try to interpret that way, because interpretation and your applicability is also equally important, because first year also you read on Masanumasika Garbhavriddhi, but how you had understood at the final year. That is what we are expected in final year answer paper. And going with Garbhantara Garbhasthiti, yes, definitely prior entering to the labor and the prasava or a garbhini, you also need to know like what is fetus in utero, like how exactly. These are the major topics of Prasuti and Sri Roga, like diagnosis of pregnancy, fetus in utero. These are the basement for your prasava in the later topics. Okay, so what I insist is Garbhashayantara Garbhasthiti shloka you have beautifully explained, and Ayurvedic is also go similar with the modern fetus in utero. So what I insist is you prepare this for 5 marks. Sometime it may even come for the 10 marks question also, but most expected is a 5 marks question, that is fetus in utero or Garbhashayantara Garbhasthiti. Okay, you're getting my point? That is about the topic number 3. And most all 3 questions, like 1, 2, 3, like 4 questions in the paper 1. These 3 are equally important. I'm going with Garbhini Vignana. Garbhini Vignana is also a generalized topic, because once you go with Garbha Vyapat and Prasava Vyapat, any disease may come. Okay, I won't say this is very important. Sometimes you may expect the other question also. But especially with the Garbhini Vignana and Garbha Vignana, these are all the generalized topics. Even it may come for the 10 or a 5 marks question. And MCQs is related to, once you must know topic, you read well. So MCQs will be easier. Okay, and going with that, going with Garbhini Vignana, already said when I was talking about fetus in utero, that is Garbhini Lakshana, or the diagnosis of pregnancy, is most expected at undergraduate. You need to be well aware of all the like clinical and then biochemical changes, how you will be examining all those things, like how the patient or pregnant, I can't say patient, how the pregnant lady will be presenting, okay, with Garbhini Nidanas according to the modern as well as an Ayurvedic parlance. You need to know about it. And especially the 5 marks question you may expect here is Sadhya Grihita Garbha Lakshanas, yes, and then Sadhya Grihita Garbha Lakshanas, usually that will go hand in hand with what do you call it, Garbhini Lakshanas in Ayurvedic parlance, and same with diagnosis of pregnancy. These are the usually expected question for 5 marks question. And then antenatal as such care in Swastha you would have read, but some more implementation in relation to immunization and examination, investigation and its management with common ailment, because it is not a disease, I won't say. The common complaints like vomiting, simple vomiting in pregnancy, how you need to tackle such few things, antenatal care you need to be well aware of. Okay, and this is, you already read like immunization schedule in Kaumarabhritya. That immunization schedule also you should be well aware of. See, only the previously like tetanus toxoid alone was there. Now even the diphtheria and pertussis where that is also detached, where that is also included. Nowadays the vaccination schedules are changing. So what I insist is you need to update with the present WHO guidelines, what they had kept for immunization. This is in brief about it. And then it is not much expected questions. If at all cognitive comprehensive, it comes where demographic statistical related obstetrics, like you had already read in Swastha, that is maternal mortality and the morbidity of fetal infant mortality and the morbidity rate. Such thing, just brief out and keep ready for 5 marks. It's not much or structured question. They may split and ask you related to this sorts of questions. Okay, these are all, say whatever the topic I'm briefing out, where and all you can concentrate. Okay, and then going with Garbha Vyapat, what can I say? See, there are much more. Not everything is important. That's what you will be saying. See, as a clinician, I say all the topics are very much important when you go with fetal pathologies or a Garbha Vyapats. But it's an exam point of view, that too at the level of undergraduate, most expected is Garbhasrava and Garbhapata. Okay, that is the first and foremost thing for undergraduation level to understand. So you have to know about it. And there is two things will come there. In Agata, you already read like MTP and PCP and DTA Act. It is not most expected. See, there is always a question like conceptual understanding and the applicability. In that conceptual understanding, whatever I said, it's so fine. But when you go with the applicability, definitely we expect MTP and PCP and DTA Act also should be known when you're understanding abortion. Okay, so in that regard, what I insist is you be prepared, whether they ask you or not, it's your mandatory thing. PCP and DTA Act and MTP Act, you have to know about it. See, we have to take in all the corners of the questions, conceptual, and when you go with applicability, they may even ask you for PCP and DTA and MTP Act. So now you pick it. Now I already commented on 4 to 5 topics. I only given just, so in a 1, 2, 3 days, if you sit and you make an alignment, you can prepare a notes on it and you can be prepared for that. That especially when it comes to the MTP Act and PCP and DTA. It's not the mandatory one. Still, there is a scope of asking PCP and DTA and MTP Act. I am telling is, in this part, conceptual is topic specific, and later they have to ask like some medical legal aspects and other thing. They may go with MTP and the PCP and DTA Act, and some disease specific. So they may go with Garbhapata or Garbhasrava or intrauterine growth restriction. In Kaumarabhritya Garbhashosha, you had a read. That is also equally important because chronic placental insufficiency is also a need of the hour. You need to well aware of. What I insist is Samanya Lakshana Samprapti, you try to learn it. Once you learn in Garbhasrava and Garbhapata, you will get benefited out it in Garbhapata, Garbhasrava, Muda Garbha, yes, and then in what do you call like intrauterine like Garbhashosha, and even in the Mrita Garbha. In all those things, Samanya Nidhana Samprapti can be inculcated. If you read in one side, that can be implemented in 4 aspects in Garbha Vyapad. So you should be smart enough. You take some Nidhanas like Garbhopaghātakara Bhavas. You buy Garbhopaghātakara Bhavas in one place. So you can, I should not tell as a faculty, but still I'm preparing you for your final exam in short duration. Try to learn the Garbhopaghātakara Bhavas, and which is beneficial, Upaghātakara Bhavas and Garbhavruddhikara Bhavas, so that any impairment you can use these 2 shlokas in Garbha and Garbhini Vyapat easily, so that it will be like a generalized statement. So you'll try to learn that Garbhapata, Garbhasrava, Samanya, Nidana and Samprapti. It can be utilized in Brita Garbha, Muda Garbha, yes, and even in Garbha Shosha, you can use it some extent. Okay, this is what just a gist, because every disease is equally important. So going with that, Mruta Garbha, like intrauterine death of the fetus, even we have a Nispure. Yes, all those things, even the cardinal features is mimicking towards the Ayurvedic and the modern same. So what I insist is these are the most expected questions, especially from Garbha Vyapat at undergraduate level. And even RH incompatibility, it's a cognitive comprehensive, not much often asked, but still you should be well known about that also. At least a few note on RH incompatibility. That's also very important. And trophoblastic, these are all nice to know, desirable to know. But I won't say you should not read, but this comes under desirable and nice to know. But what I insist is from practical perspective, you read it and keep a note of it. Yes. And then going with intrauterine female, I already said, and Rakta Gulma is also in Sriroga. It's a specific, most expected, undergraduate level, it is expected for 5 marks question as per your syllabus protocols. And then going, even though it is potential to ask for 10 marks, but undergraduate level, what I think is it's a suitable for 5 marks question. And going with Garbhini Vyapat, yes, same as such of Garbha Vyapat, Samanya Nidana and Lakshana. Try to learn for Garbhini Vyapat also. And main thing is Antarvatni Chikitsa of Kashyapa Samhita. If many are good at, read that chapter. You will get a gist of all Garbhini Vyapats. If you have a time, read that one chapter, so that Antarvatni Chikitsa of Kashyapa Samhita, you will get a complete explanation of Garbhini Vyapat. Okay, Samanya Nidana Chikitsa, try to mug up the shlokas because it's really need of kya for your university exam. And majorly, we are expecting here majorly 3 diseases in Garbhini. Garbhini hypertensive disorders, like especially the Garbhini Shota, and then Garbhini Prameha, like gestational diabetes, and even we go with what do you call Pandu, that is anemia. And one more is Garbhini Garbhaja Vamana, that is emesis gravidarum and hyperemesis gravidarum. These 4 diseases, if you learn, that is too good to understand. And then hemorrhages in early pregnancy, that also comes under Garbhini in a pregnancy related disorders. APH, antepartum hemorrhage, like placenta previa and then abruptio placenta. These are the 5 topics it's allotted for you. Yes, all 5 are equally important. Prepare for 10 marks notes and keep aside. It may ask for a 5 also, 10 also. Maximum questions will be expected because the clinical point of it, because diseases, right? Most expected, usually undergraduate level, like eclampsia, pre-eclampsia. So don't go with beyond eclampsia. It's like, see, it's there for scope to ask, but try to brief on it. Like 10 marks, you be prepared for these 4 questions, like Garbhini Pandu, Garbhini Chardi, and then hypertensive Shota, like hypertensive disorders, especially on the pre-eclampsia, and then go towards gestational diabetes. At least it's not that too much important, Garbhini gestational diabetes, but you should know at least brief note on gestational diabetes. And high risk pregnancy for 5 marks question as a brief note, if you know, that's more than sufficient. But LAQ, long answers question in this, all 4 diseases what I said, and one more is antepartum hemorrhage is very much important. They may ask you placenta previa, abruptio placenta differentiation. If you read into the DC Datta, get a beautiful explanation of it. Try to learn that one column. Yes. And going with Prasava Vijnana and the labor, as such labor, the stages of labor, and in Ayurvedic perspective, when you think of Prasava Hetu, we have an explanation for that. And when exactly the Prasava starts, for that even you have one explanation. Masanumasa Garbha Vriddhi, the last, Dasham Navama Dashama Ekadasha. Yes, Prakrita Bhavati, otherwise we call it as Vaikrita Bhavati. That is the time of onset of labor. You can understand in an Ayurvedic parlance. And Prasava Hetu, and then Prajayini, Asana Prasava, Upastita Prasava Lakshana, and then Avakshirasiya. These are the 4 things, and Garbhashayasta Garbhasthiti. These are the 5 shlokas, if you understand, that will give an insight into the Prasava. Okay, this is the 5 things. If you learn, Ayurvedic Prasava is completed. For undergraduate level, I'm telling, because if you understand, even beyond, you can go with a learning where even we have a reference of if what is that, where Grahishula, where Grahishula and the Navishula is not the Vilambita Prasava, where delayed labor also we have a reference. But at least undergraduate level, try to read on these Prasava Hetu, Asana Prasava Lakshana, Upasthita Prasava Lakshana, Avakshirasiya, and then Garbhashya, the Garbhasya. These 5 shlokas, if you learn from Prasava Vijnana, your Ayurvedic parlance of labor is done for some extent to the Ayurvedic, and you need to read story like it is, but still you need to learn in the point wise. That is Prasava Paricharya. How Ayurveda beautifully explained about the Prasava Paricharya. And then modern perspective, there is no other way to go because the mandatory question of LAQ, labor, stages of labor, mechanism of labor, yes, and the definition of labor. They may split and ask you at any point. So these are all the things you need to be learn on it. Okay. And then clinical pelvimetry, pelvis. Anyway, it is there in the pelvis chapter in the Sharira Rachana. There only you try to inculcate the pelvimetry and the pelvis there only. If you read first topic correctly, then this Prasava Vijnana will be easier for you. That's what I am telling. Your anatomy and physiology are so versatile. Then you can handle the pathology so easily of any diseases of gynec or obstetric. Okay, that's what you try to learn about, like Prasava Vijnana and other thing majorly. Okay, I think I'm clear with that. And definitely when the labor is going on and the 5 marks question is awaited undergraduate level, that is episiotomy. It usually asked for this thing, and then partograph will come. Okay, it's a graphical representation. Probably you know about it. How the labor process will be progressing. That is what we'll be assessing. Partograph, intrapartal monitoring is a very much essential topic for 5 marks question. And even though they may ask you like stage 1, 2, 3, like what do you call labor, even stages of labor. There even they may ask you single stage. Tell me the stage, like what is the first stage? Explain its clinical course. Yes or no? They may on the management of first stage like that. They may ask you single stage 1, 2, 3 separately for 5 marks, or as a whole they may give you for 10 marks question. So this is most expected mandatory question. One or the other way you will be expecting from this topic of Prasava. Prasava Vijnana is definitely need of the art. You have to read on it. And Prasava Vyapat, yes, the complication here also Samanya Nidhana. Okay. Once again, you should understand Prasava here. And majorly, if you know like Prasava Hetu properly, any derangement in that may lead to the Prasava Vyapat, especially the power passage and passenger related things. You should understand, and you need to know the difference between here. Only the major question for 5 we expected is obstructed labor and the prolonged labor. There is a difference. Obstructed labor and the prolonged labor. Obstruction maybe with the bony or a musculature, and the prolonged, the duration, you know, like 18 hours is in average, it is the duration of the labor event to takes place from the true labor. If goes beyond, that is a prolonged. Okay, here what are all the reasons in respect to the power, passage and passenger. Try to understand these 3 P's in a better way in labor, so that you can interpret all the diseases of Prasava with your own base knowledge. Okay, if you're good at Prasava, labor, normal physiology of normal labor, then interpreting the Prasava Vyapat will be easier. Okay, that is goes hand in hand, but only one specific diseases is a mandatory for a 10 or a 5 marks question, postpartum hemorrhage, because you may ask you the question like they may ask you obstetric emergencies. Okay, in obstetric, it is because your clinical interpretation we expect, then they vaguely give like write about the clinical emergencies of obstetric. Then you can comment on antepartum hemorrhage, postpartum hemorrhage, any hemorrhages in early pregnancy, maybe like abortion, how to tackle such things, and preeclampsia. Yes or no? You're getting, these are all considered as obstetric emergencies, eclampsia and preeclampsia, heavy bleeding, maybe during pregnancy, intrapartum or postpartum. Any bleeding, that is also an obstetric emergency, and the vomiting in pregnancy, severe hyperemesis gravidarum, that is also an emergency for it. Yes, like that. This is not specifically asked because high risk pregnancy you have. So they may ask you as a vague. If you're too good at in physiological aspects of labor and the anatomy and physiology, then you can assess the pathology very well. So in this regard, what I insist is this, especially the Prasava Vyapat, Garbhini Vyapat, these all comes as a major question as obstetric emergencies that you have to aware of. Only the management, you at least, these are the emergencies, so how to tackle that. If you know that at least what are the emergencies condition like antepartum, postpartum hemorrhage, and then abortion, that is also an emergency in obstetric, and then going with pre-eclampsia and eclampsia, tonic-clonic conversion during pregnancy. Yes or no? These are all considered under emergencies in obstetrics. Then how to handle that? Okay, the management of that, because you have a flow chart for all those things and try to make a gist of it and ready. Even though they ask you a vague question, you can interpret in a better way. And see, ma'am, you are saying every topic is important, then how we can go for it. What I insist is try the base of anatomy and physiology very well at this point. Probably you're good at, but try to interpret. This is already, if you take a 2 to 3 days, you can understand in a better way and you can implement it very well. But what is the concentration and making up of your mind to sit for minimum of 1 hour in a day? See, sitting for 2 hours long and you're not understanding, it's a difficult task. So what I insist is make a short notes of it. Whatever the topic they'll ask you, at least you won't skip. You understand the word meaning of it. What is what is antepartum hemorrhage? Hemorrhage is what? If you know such word meaning, because definitions are there, you have a clinical definitions, yes, and theoretical definitions. Then how to implement? If you know that word meaning, you can write it in a better way. And when it comes to the labor, power, passage, and passenger, if any deviation in that, because you should not lose. Man is telling so much. Postgraduate, but UG level, definitely we expect Nirukti of it, Samprapti Veda as general goes with, I already said, Garbhini, Garbhasrava, Garbhapata, and then intrauterine like Garbha Shosha, Mruta Garbha, and Muda Garbha. These all 4 to 5 entities will go with Samanya, Nidana, and Samprapti of Yoni Srava. So you learn that Yoni Srava and Yoni Pata, Samanya, Nidana, Samprapti, and Chikitsa, that will holds good in all the conditions of this. In Muda Garbha also it goes, they mention, you have to treat it in the line of Samprapti, Nidana Samprapti. When they mention, they usually comment like that. So you have to read that topic very well, Garbhasrava, Garbhapata, and later this can be interpreted because Garbhopagatagara Bhavas, you can take a help of it and you can elicit or you can depict or you can draw a Samprapti of Muda Garbha, and definitely CPD, cephalopelvic disproportionate, like fetal pelvis and then maternal pelvis and the fetal head disproportionate may lead to the CPD, and then mild, moderate, severe. There is many form of it, but at least what exactly it is and what will be the problem with passenger and the passage, that you have to interpret. So you will get an answer. That is what your common sense will come into the picture in understanding of Muda Garbha based on your first topics. Okay, but you can do it, and usually it will come for 5 or 10 marks question, like how anatomy and physiology is there in Prasava. We expect, I mean, especially in this thing, Prasava during labor. Normal labor is one part, and then abnormal labor and the presentation will come under Muda Garbha. Okay, and here in the modern parlance, in Muda Garbha and other thing, you have to know about what is augmentation and what is induction. That is expected question for 5 marks. Okay, and they may ask you at least to mention few. You need to know like what is assisted labor technique. That is forceps, vacuum, and then cesarean section some extent, because cesarean section, one surgical. See, once the theory is asked, theory portion conceptual is asked. They may ask you legal aspect like PC, PNDT and MTP. And the same way, the surgical also they should ask in relation to the obstetric. So in obstetric, what are all the surgery we may expect it? Assisted labor techniques, maybe forceps, vacuum or cesarean section. Mandatorily, they have to pick from that also, right? One portion is there for surgical thing and investigatory tools also. That is not there, but still USD. In the last topics, it is mentioned. USD, importance of USD in obstetrics. That is the most expected question for 5 that you need to be well known, like what is the significance of early pregnancy scan, how you will, what are the key indicators or the key points you will be looking for, and then NT scan importance, anomaly or a TIFA, like what is the importance of target scan, and then even the growth scan, how we will be, and the Doppler scan. Okay, go and then antenatal profile in the ANC probably you will be reading. That also may ask as a generalized question in your first paper. And one more like question where also all the 3 questions are possible. That is Sutika Paricharya. Yes, what is Sutika and then what is normal and abnormal purpurium? Yes, and the Kala of Sutika, because everyone had explained the Kala of it except Charaka. Then what is this like Samanya Sutika Paricharya and Vishesha Sutika Paricharya, because Kashyapa had even went to the extent of Vishesha Chikitsa, like Vishesha Paricharya of Sutika. All those things you try to know the key points of it and try to write on that. And already you had read on in Swastavritta, like family planning methods, yes, intrauterine devices and other things. And same here also holds good. Along with that, you need to know about tubectomy and vasectomy. Okay, there is a 2 surgical points we will be covering in Prasuti, and then Sutika Vyapad, like Nidana, Samprapti and Lakshana Chikitsa. Common because you don't have a specification what need to be, because previously when your senior batch was there, they had an explanation for the disease specific, but you don't have what diseases have to be concentrated, especially in the Sutika Vyapad. Usually the Sutika Jwara will come into the picture and Sutika Makkala. It's the common thing we usually come across. And Stana Vidhradi. Okay, it's a postnatal, right? We usually expect that. But for you, there is in your syllabus, there is no specification what disease they have to ask. So there is like 2 chapters dedicated for Sutika Paricharya and Kashyapa Samhita, like Sudikopakramaniya and Dushprajatiya, Prajata Adhyaya. That is, these are the 2 chapters. If you read, your Sudika Vijnana is done. Okay, full whole details you will be getting from those 2 chapters. So that will complete your 10 topics of first 10 topics of Prasuti Tantra, where all the LAQs, SLAQs, and then multiple choice questions are expected. Because you already know, like see, almost 8 plus 4, almost 12 questions are expected from these 11 topics. That means definitely they have to ask 1 question from the each. And you already know, like Sanya Vijnana, the last topic. Here they can't ask you, like only they can ask you physiological aspects of lactation that you will already read on Sutika Vijnana. Okay, physiology of lactation is there in the normal purpurium. We can go through with it. Sanya Dushti, Sanya Vidradi and other thing you already read. Sanya Sampat and other thing already in Kaumarabhritya. See, they can only ask LAQ. Definitely they can't ask you because syllabus they had not specified for LAQ from Sanya Vijnana. Means in top 10 only they have to ask 4 questions of LAQ. You're getting a smart work is required here, right? So you can only expect a 5 marks question from Sanya Vijnana, and multiple choice question. Definitely, it's once again based on your knowledge and the topic. You can must know topic only will be taken for that, right? So only thing is must know topic of Sanya Vijnana you have to read. Okay, this is how you can simplify your 11 topics of Prasuti Tantra for 100 marks for easy understanding and interpretation. And in a gist, we will be expecting 1 anatomical question, 1 physiological question, and diseases from this Garbha Vyapad, Gurbini Vijnana or Prasava Vijnana or Prasava Vyapad. Definitely we will be expecting LAQ. Definitely they should ask 1 anatomy question and physiology question and diseases 2 questions. 1 question also at least they should ask from the disease perspective and 1 from Surgical point of it, we already come across with cesarean section. Yes, what on the this surgical point we come across where? Like forceps, vacuum, and then cesarean section. These are the three major surgical aspects we come across, and even episiotomy will come there. There is a four surgical points, and one more is like just now I said, like going with surgery like contraception, like tubectomy and vasectomy. Means 5 surgical point questions are there. So among that, one or two they may choose for your LAQ or SLAQ. You're getting my point? That is how you will be splitting. On the medical legal parlance, if you want to put one question, they may ask you go with PCP and DTA or what do you call MTP Act. Okay, that is most expected. And in Stanya Vignana, once again, one more physiology will come. One is menstruation, one is physiology of lactation. And physiology in relation to physiological changes during pregnancy. These are all the 4 physiological questions we may expect for SLAQ and LAQ from your paper 1 topics. Yes, you're getting my point? These are the things what we will be expecting from paper 1. You're getting the things. Do you have any questions? Yes. If another 5 to 10 minutes is there, I had made simplify with your syllabus topic, like few expected questions, what may be the chances of your based on your LAQ and SAQ, few things, and anatomy, what sorts of, like in anatomy, both the internal organs and the external genital organs, and even the possibility of female pelvis, and even arthrosrotus is there, and then peshis are there. It's on a ligament supporting, uterine supports are there. They may ask you anything. So you and the marmas and peshis are very specific in Ayurveda. UG level, that is the most expected questions for a 5 marks question. Stri, Vishesha, Marma and peshis. Yes, this is a few expected questions from LAQ. They may ask you structure. They may split and ask you 2, 2, 2, 2, 2 and making a 10 marks question. It all left to the paper setters. But still, because it is specified in your syllabus copy, LAQ should be structured question. Okay, LAQ, they can't ask you directly. They have to go with, structured, cognitive level and applicability analysis and synthesis where they have to interpret. So LAQs is always be framed like multiple question in a same single heading. So structured questions will be possible. Okay. And then in short, long answer, see, everything is whatever possible ways I had condensed, but still it is once again, your anatomy and physiology is too strong. You can make multiple questions by yourself also. This is few things, what are all the possibility they may ask you for 5 marks I had made. And MCQs you're already good at. Few to show, only 3 I had made. Like this, much more. See, your theory is too good. Triavarta Yoni name only suggesting 3 avartas. Normal position of the uterus, your anatomy is too good. You can write like antiverted and anti-flexed. And then largest part in, because you know, like body isthmus and the cervix. So how to differentiate? The largest part is the body of the uterus. Like that, if your anatomy is too good at, okay, then you are only can answerable for such question. This is about like few examples. It's possible only for your exam point. How it is like same thing holds good for your topic 1 to 11. Why? What I want to say is at the end, you prepare this 10, 11 topics, 10 marks question, so that whatever the question they ask you, you can interpret and write it in a better way. Clear? Do you have any doubts? Because if I time permits, I thought of going with the paper 2 also, but it's already like, I think I had taken a maximum time of 7:30. It's already. Yeah, if time permits, if next chance I'll get it, I'll try to do it on the paper 2 also. Yeah, and see yantra shastras, like you already know, like 20 till 24 topics is included for your term 1, term 2, term 3 PA assessment, and the last 4 topics, yes, that is shastra karma, Sri Roga Sambandhi Aushadhis, and the national health programs, and medical ethics and record keeping audit. These 4 are general topics for both Sri Roga and Prasuti. Okay. And in Sutika Paricharya, in Sutika Vignana, I forgot, They may ask you like explain the yogas, because they're specifically mentioned 4 to 5 yogas in Sudhika Vyadis. They at the UG level, they may ask you like explain the yogas mentioned in explain Sudhika, what exactly the definition of Sudhika, and explain about yogas mentioned in Sudhika, where you have Pratapa Lankeshwara Rasa, okay, and then Jirakapaka, is and Jirakarishta, Avaleha, Pancha Jirakapaka, like that specific yogas have been mentioned in Sudhika yogas. They may ask you for 5 marks from that, or even Sudhika Paricharya is expected for 10 marks question also. Yeah, that is one thing I want to, because it is most expected only 4 to 5 yogas are there in Sudhika Vijnana. Try to read on that 4 to 5 yogas. Okay, there is no much explanation on Sudhika yogas. That 4 to 5 yogas in the last of Sudhika Vijnana you have. Okay, that you can go through it. Like that, I had made a few short answers. See, whatever, it's already structured. Our syllabus is framed in such a manner that it's already a structured one. I only can do it. I can only pick up and consolidate and then can give you. Yes, that is how your question, your syllabus is framed. You can only make a filter and you can make LAQ, SAQ, what type of question they may ask you with the topic, and you can segregate. But this is only just, I tried my level best to give a gist how you can concentrate. And I already said anatomy, physiology, and one from surgical perspective. Expected questions will come. And among 11 topics in the paper 1, top 10 topics are expected for LAQ. From that 10 topics, only 4 LAQs will come, and SLAQs are 8. That means you have to prepare for 10 marks for all the topics. Yes, so that you, even though it asks for the 5 marks, you can condense and write it. Yes, is it clear? Do you have any doubts? Because already it's a long session. If time permits, I'll try to take it in the next sessions on paper 2. Yeah, do you have any questions or queries? It's just a few, Rutu Chakra, and what are the probabilities? See, once again, reading these questions and preparing, it will be difficult. Okay. Sadhyagrita and Vekta-Garbha Lakshanas are most expected questions in your thing. This is just a brief of mine. But still, do you have any questions or queries? I'm welcome for it, because I need to give for that also a bit of time. If any questions or queries, it's welcome for me. And see, it's always how you, because you're already in the final year, definitely I'll wish you for your exam all the best. And at the same time, this is the time, try to read on it. And see, Ayurveda is for wellness and even for the disease. So based on your interpretation and knowledge achievement, you can put for every patient or every couples or whoever it is. Okay, in gynecological perspective, if you think on disease specific will come. See, finding a hope and dealing through Ayurveda, because Samhita is so vast. How you understand and how you interpret and learn at this juncture will help you to go further as a good clinician and academician. So what I is the wrong time, because you're expected to write your exam. It should be there from the beginning, but still I want to go with the colorful birds outside. So wherever you go, leave with the Ayurveda and make sure that Ayurveda first for a wellness, and try to, if you properly follow the Ayurvedic principles, you can go with the wellness. So in this, I conclude my session of first session of on Prasuti Tantra. And if time permits, in the next sessions, I'll try to cover on the Sri Roga perspective, what and all you can concentrate. Yes, any questions or queries? Yeah.
Yeah, thank you, madam. Dear
Yeah,
students,
thanks.
if you have any questions, please, you can ask. 5 minutes is there.
I hope I'll try to take a half paper 2 in the succeeding class if time permits. Yeah, if any thing or any suggestions, both are welcome from your side. Because it's a vast topic, condensing a whole 1.5 year to the just 1 hour, 1.5, like 1 hour is so difficult. But it's only just to give an insight how you can prepare well, where and all you can concentrate. That is the only thing I can tell you at this point.
Any questions you can ask? Otherwise, we can conclude the session. Any questions?
because your exams are also nearby, right? In this regard, you try to work on the things. Clear? So I had even kept the things for you, like my details. If you have any difficulties, you can reach out me. I'll try to help you with the same.
Okay. Thank you so
Yep.
much, madam. We
Yeah.
even we having a busy schedule, having national seminars and then
Yeah,
international.
shortly I have on, it's like open
Yes,
access.
we
Today is the
have to-
last date for enrollment. We are going with Yavana Ruda and the Puberty National Seminar from our department. We are from the organizing committee. Shortly, another from tomorrow, it's scientific sessions are starting, like online presentations. On 22nd, we have a major day on national seminar on Yavana Ruda, that is on puberty.
even though having a busy schedule, you given your time, 1 hour time for our students, madam. Thank you so much.
Thank you,
Because
Krishna,
of,
Ayurreshmi team, and then Dr. Krishna for giving me an opportunity in the same regard. Thank you,
yes,
Dr. Krishna.
from Ayurreshmi and students, we are thanking you, madam. In planning the second session, we will reach out to you, madam.
Yeah,
Yes.
shortly, like preferably after 22nd, because I even pursuing my PhD from KLE, and I'm conveying, like I have on 20th and 22nd, even I have an online presentation there to submit my data. Like after that, if you are willing, then I'll try to join
Yes,
you
ma'am.
on. Yeah.
All the best for your presentation, PhD presentation,
Yeah,
madam.
thank you. Thank you so much.
Thank you so much, madam. Thank you. Thank you,
Thank
students.
you.
Thank you.
Jyotika, ಹೇಳಪ್ಪ.